All right. We are live. Welcome everyone to another monthly live stream and coming and sharing your lovely Saturdays with us. I love doing these, but I love it even more when we have guests. And Beju, one of my great colleagues. So thanks for coming on and spending your Saturday with me as well, Beju.
I was gonna say, is it Saturday? I can't keep track. That's, it's like a blur this week, really. It's kind of blur.
Busy
But yeah,
week.
thanks, Brian. Yeah, it's been a busy week. It's been a busy, well, we go by quarter, so it's like being a busy quarter.
Mm.
But I also say it's an exciting quarter. So I haven't actually announced this, and so your viewers are going to be the first to know. But I've actually changed roles. I've changed
Oh,
roles with the company I work with. Yeah, so um,
you
it's
want to share
been
about
more
that?
of
Actually, why don't we
yeah,
start with that?
absolutely. Yeah, yeah,
If you want to
yeah,
give a brief introduction to yourself and then your new role that you've
yeah.
now taken.
Yeah, that sounds great. It's good. Hey guys, I'm Beju. I'm actually a telemedicine success manager, a senior telemedicine success manager at DoxyMe, which is essentially a telemedicine company, a solution. One of the things I do with the company, or have done with the company, is work with enterprise and government customers to really ensure successful outcomes of their solution implementation, all the way through to they're really just looking at the outcomes and trying to figure out how to optimize their system. So I spent about a year with DoxyMe, year and 4 months with DoxyMe in that role. And so this kind of month is actually being new because I'm starting a role with marketing, which is a really, to be honest, a really a new space for me. But it's one that focuses on how do we get the word out to the healthcare professionals that really could use our solution, or could use some of the best practices that and sort of education, I suppose, around of telemedicine in general. Specifically, my goal is like prescribing and
Mm.
compliance, regulatory kind of issues that surround telemedicine. Um, and so, in that capacity, really becoming a lifelong learner of this space, but also kind of seeing what's next. What's the latest in updates from the government, from organizational perspective, and then from the states, and trying to figure out, where are we headed as well, being that guide for clinicians. So yeah, pretty exciting.
Very nice. Well, thanks for sharing that. I think we're definitely going to get a little bit into the telemedicine world. And it'd be great to have you share a little bit about that. Um,
Yeah.
a quick housekeeping, because this is a live stream, we always love interactions. So if you're tuning in right now, you are watching us live, let us know in the comments, where you're tuning in from, what's your name, and then feel free to leave Beju or myself any questions that you might have. Okay, so let me do a quick plug for my own stuff real quick. I'm going to share my screen. I was just telling Beju about this. I recently launched OpenClin Tech. And the reason why I want to bring this up is because started to populate content, and it's in this Learn tab. So in this Learn tab would be basically, you can think of as like a course catalog of everything you want to learn. As the name suggests, it's open, so everything's public, it's free, it's just out there. And these are the YouTube playlists. You will see all the content as they come out. Go on the playlist. If I go here, everything is kind of organized. This would be the main way of organizing things. Just watch, and this is a hands-on demo of CRUD operations. But you can do the same thing, and then there's more guided learning that will be incorporated within the OpenClintech website. I think this would be more of the bread and butter because YouTube doesn't do a really good job of organizing content. But you can click over here. All you got to do is register as a member, and this will be more of like, there's accompanying text kind of elaborating on each video, like what these are for. It's not fully built out, and to be honest, it's probably gonna be very rudimentary for the most part, but all free. Feel free to check it out. I'm hoping to spread more knowledge of just everything related to biomedical informatics, technology, and healthcare on here.
I love that. I love the fact that you put fire corrupt operations. That's such a great title. I definitely would click on that and check it out. I'm gonna definitely check it out, Brian. Thanks.
Yeah,
Thanks for sharing that. And it looks pretty awesome.
Yeah, thank you. Maybe a quick question on that too. Do you guys use Fire a lot in your telemedicine solutions?
So our company doesn't necessarily do that. Maybe webhooks, I think, is kind of we established some webhooks. So if we're looking for like if some of our customers are looking for like integrations, we have some capabilities for sure. We have actually got a new Epic integration, which is kind of like exciting, just because we both come from the Epic world as former informaticists in the health system. So yeah, there's some exciting things, but no sort of not yet. At least we don't have anything as yet. I'm sure we have things on the roadmap in terms of true sort of APIs and things like that. So
Okay.
Yeah. See a lot of comments coming in, by the way. I recognize a lot of names here as well.
Yep.
Carrie.
Good morning to Carrie. Tuning in from the Bay.
And Abraham, of course.
Yep.
By the way, I think Abraham is back in the US, if I'm not mistaken, right? Right, Abraham?
Back in the US. So I take it he took a little trip outside of the US in that case?
I think so. I wanna know more. Maybe he can like message it in on here and keep us updated.
Very cool.
But,
yeah, let us know if you got some fun vacations to share and stuff. Okay. Well, Beju, let's kick it off. I know we want to jump into telemedicine, but let's also jump into conferences. I know that this is a topic that we want to talk about, and I know that we both plan to probably attend ASHP mid-year, right? Is this year? Is that right?
I think we need to do this. Yeah. So where is it? Anaheim, right? We're looking at Anaheim, California this year in December, I believe the second week or December the 5th onwards, I believe. So yeah, if anyone is planning to join, love to kind of hang out and maybe just catch up. That would be really cool. So I think that's in the works. Not confirmed yet from my end, but yes, we should definitely do that. Oh, thanks, Abraham. Yeah. So yeah, you are originally from New Zealand, but you're spending your summer here. That's right.
Oh, from New Zealand. Wow. Super cool. That's a place I would love to visit one day. So December 3rd to 7th is the date of mid-year. So what is holding you back from confirming, Beju?
Yeah, so good question. I'm still waiting on an abstract submission for a telehealth conference here in South Carolina. So I think there's a bit of conflict with the dates. So hopefully I'll kind of get that cleared and either way, kind of want to make it to a pharmacy conference in the near future because to be frank, I miss the world of pharmacy professional community and I think we've been talking about this for ages, but the last I think what was the last conference we were at was it 2018 or something like that, and you don't really get to meet a lot of pharmacists first of all, but also pharmacists in tech or in informatics is a really small subset, so it's really hard to kind of make those kind of connections in person. So anyway, yeah, definitely want to make it happen with a pharmacy professional conference somewhere along the lines. And I think Tony's going to be joining because he's in SoCal.
Yeah, that'd be super awesome to see Tony. And maybe a quick question related to the last time we attended. So last time I attended ASHP mid-year was 2019, and definitely agree with everything you said of
yes.
I miss interacting with other pharmacists, especially other pharmacists in like informatics. It's been a very, very long time. And in our roles, as we transition, I'm sure our interactions have decreased quite a bit to other pharmacists. So
Yeah,
Definitely
I
agree.
remember. I remember actually we had presented in 2018, the year before,
Mm.
and the same very same presentation. My wallet was stolen. So a very memorable moment. But yeah, a little backstory for the guys and gals who are watching. But I was essentially presenting with Brian and a couple other folks, and I think Marissa was actually
Mhm.
coordinating the presentation for us. The day before, I was out and about, just a few blocks from the conference, and I somehow my wallet disappeared. I think it was still pickpocketed. I don't know. I
Mm.
can't confirm it. Um, but ID, cash, all that was gone. So thankfully, hey, we had some help from Brian and team, and kind of got it all sorted out. But boy, that was a memory. So I will say, conferences attract a lot of great colleagues, but they also attract a lot of bad elements. So be careful when you run that. Go around with wallets and things like that. Just be secure, I guess, in these high profile events.
Yeah,
Um,
I should probably return your wallet at some point.
okay, all right. So it was you
It
finally
was me.
figured
Yeah,
it
I admit it.
out.
A couple years later, but
That's
I guess
funny. That's funny.
quick acknowledgement. So it's pretty cool. So Abraham is just visiting for the summer. This is a side tangent in a bit, but how do you
Yes.
know Abraham, Beju? Have you guys previously met?
Uh, yeah, I think we've chatted on audio for sure, LinkedIn audio, right? And um, yeah, I'm hoping we can kind of all meet in person. So I don't know, Abraham, if you got anything going on this summer, that would be kind of cool to know if you're headed to any events or conferences. Um, yeah, thanks, Tony. And yeah, we met the same day I lost my wallet. So thank you for that. So reminder there. Um,
That's when you met
yes,
Tony. The same day you lost your wallet.
I guess so. I guess so. I'm that is something I'm kind of blanking on, but
That's kind of funny.
it would make sense because I was kind of like crashing free events from pharmaceutical companies at the time. So losing my wallet, having no money equals going to free events with free food. That kind of makes sense. So I don't know.
Hmm.
That's
Okay.
getting into that. What are the things? What are the opportunities available in conferences? Right. I think that's a very valid kind of point. It's like you have speaking engagements, presentations, just thought leadership activities. I think that's a great way to kind of build relationships and to share your knowledge.
Mhm.
Certainly. But like, how can you do that? One of the things I'm trying to figure out in my new role is actually spearheading event planning and strategy. And so
Mm.
for my team, so that means really kind of getting out our thought leadership hats. So I'm a pharmacist, so I'll kind of put on my pharmacist hat and talk about prescribing. Right? Let's say I've got a fellow physical therapist, PT, who doctor PT, who he's going to be talking about that world. And then, other professionals, mental health and social work and all these other professionals as part of my team. And so everyone has these strengths of like, having these insights from their professional background and educational, insights that they can share with the audience, that are using telemedicine. So I think speaking engagements, thought leadership activities like that, it's a really great way to provide value for the audience that uses our solution, let's say.
Mhm.
Um, but what are my question is like, what are the other ways you can kind of educate or share knowledge that may not be a speaking engagement, may not be a presentation,
Live stream,
but
maybe.
there are, right? So yeah, so that's a great point. So can you use social media
Mhm.
at a conference, perhaps live stream from there? Like, what are the ways you do it, Brian, or audience?
Yeah, I mean, I'm a big advocate of live streams. Maybe like taking a completely different perspective and almost opposite of what we were just talking about is
Hmm.
I find that conferences or the in-person engagements perhaps could be prohibitive to like the larger, broader audience that may not be in some of these circles. So I'm a huge fan of social media and just sharing our knowledge publicly accessible, anyone that has internet and they can see and watch. I think that's one of the best ways of educating. And my target audience is usually the younger folks who are just getting into the workforce. So YouTube is a big one. I haven't really fully adopted the TikTok thing, which maybe is a younger demographic, but social media in general, I think is a great way to share what we learn, thought leadership, as you were saying, to the broader audience. But I wanted to ask a little bit about, well, there's actually 3 topics on my mind as you were talking. The first is professional development, because we are in a little different area of pharmacy, if you will. The second is how your role compares, because right now in health tech, I think about product management as a big area, engineering and more technical thing as another area. But your area, I'm don't have a lot of knowledge on. It's like very foreign to me. And I would be very curious to know things like how it differs or what skills you need to learn, which maybe segues into the professional development piece. And then the last piece is let's focus on what are the new up and coming things with telemedicine. What can folks do and things like that? But let's start off at the beginning, which is more of the professional development side. So let's say one of the questions that I get, and I'm sure you get very often, is, hey, I'm a pharmacist. I would like to break into health tech. What are the steps I can take to get there? What are some things you would do, Beju?
That's a great question, and there's multiple ways, right, to kind of go about as we know. So I mean, one of the ways I think is particularly useful is, well, first of all, let me just kind of zoom out and just say we need clinicians, like healthcare professionals at the table. We really need them to be part of, let's say the vendor space or some of the solutions that we're creating for health systems. Because what I often find is, when you go to some of these companies, they really don't have that sort of experienced professional in-house or at the table, and so perhaps things are often missed or not acknowledged the way maybe a clinician would think about it. And so it's really important for pharmacists, I would say, as well as other healthcare professionals, to really just kind of jump into health tech and I will say with a caveat, after having some experience of time. And so whether it's a residency or being in practice for a number of years, I think those are solid foundational skills that can really help in the health tech space. But again, there's many ways to get in or break into health tech. So I'll just give you my perspective, which is really trying to figure out a problem to solve, and then really just becoming the expert of that problem, the subject matter expert. And then when you go, let's say you go to a company, in my case, it was KitCheck, now Lucite, at the time. I was already familiar with what they were building, how they were building it, and I could provide value from day one. So it's kind of like one of those things where you build this toolkit. You may have certain skills like data analytics. You might have certain skills around managing your customers' accounts, right? Things like that. That's all great, but there's a ton of other people who can do that role very easily, but they don't have that experience, right? The subject matter experience. So I think that's the biggest differentiator is building up that subject matter experience, and then targeting specific companies who are looking to build in that space, whether it's specialty pharmacy, whether it's drug diversion, a whole host of other things that are related to medication use or pharmacy, right? So that's kind of where I would start.
Okay, can I ask, the the same question in a slightly different way, because I think this would be an interesting perspective too, which is there's a lot of folks out there that talk about getting into health tech, myself included. We always have our different perspectives. What is the most common misconception have you come across so far with getting into health tech? Like, what is the thing that people get wrong most often that you think is like, maybe you shouldn't do that? Like, what's like one or two things that you think?
For the folks who are jumping in, or the
Getting into
folks
health
who
tech.
are recruiting? Okay. So what do they get wrong? Like kind of like what's kind of a pitfall? Is that kind of where you're going at? Okay.
Pitfall,
Okay.
misconception, bad advice,
Okay.
things like that.
Yeah. Yeah. So I would say I mean, like, in my perception is like, I always thought you really need these like hard technical skills. And you do in some roles. So like there's a sort of technical role that you can get into in health tech, or these non-technical roles. Sure, have to have like technical competency is really useful, but end of the day, there's a spectrum. So like, a lot of folks used to ask me, do I need to know, data analytics like SQL, Python, all these skills to jump in the role? And I often said, like, what are you looking for? Like, what are you going for? Like, does it make sense? I mean, if you're going in engineering or product, yeah, maybe. But if you're going into something like customer success, or into account management, or into sort of my role, which is marketing and branding. These are areas you don't really need that. But I actually came across this really interesting term that I wanted to maybe kind of mention here is it's called just-in-time learning. So JIT learning, right? So just-in-time is kind of a familiar concept, right, in business, and in operations, manufacturing specifically, where you kind of you get pull the knowledge you need to apply it to whatever role you're in. So in my perspective, like, I'm now kind of giving an example. I'm joining the marketing team. What I'm doing is I'm really just learning, adapting, learning on the fly how to operate in this new role. So give me an example, creating a conference strategy, right? Like, right now, I'm just deeply embedded in the research component side of things. Figure out like what do we need, what do we not need as part of the kind of content strategy, and then how do we create a framework around that? How do we make sure it's something that will make sense? We can justify it. We can measure, and then let's kind of build that framework, and let's kind of test it out and validate it, and then iterate around that. So that's kind of a great kind of terminology, because we're all lifelong learners, and we can kind of do this. Now, also, I will say one really, really useful skill that I came across at the very beginning was product management. And that sort of set the tone for how I do everything almost, like even today. So I mentioned, this conference strategy where we need to set something in place. We need to build something, measure it, and learn from it, right? Product management essentially is that sort of higher kind of concept or framework that allows you to think on how really to do that, and then how to validate your solution through that sort of approach. And so I think, if anything, I would probably just recommend folks, go to the library, grab a book about product management. I've got a few recommendations. If you guys want, you can, I'll share them. But I think it's a really good skill to have as part of your toolkit. But again, the misconception is you don't really need highly technical skills. You may or may not need highly technical skills, but really it's more of learning and adapting to kind of the role you're in, because inevitably you're not going to know how to do something, and you'll have to figure it out, right? So I think health tech is very fast. We really, in some cases, very, very fast, depending on what stage of startup or or mature company you're at. But it is also there's a lot of uncertainty that you have to figure things out, and so big misconception to me was the technical component.
Yeah. Super interesting to hear that. And I'm kind of curious what, as a follow-up, is the most important skill you think individuals should have in your role? What would make a fantastic customer success professional? Like, what is the most important skill set you think that folks should have? And perhaps a skill set that pharmacists naturally don't have. Like, what is something that you think is most important?
Oh, that's a really tricky question because we're talking about a generalized. All pharmacists don't have this, right? And there's probably going to be a spectrum, right? There's going to be folks who do. But I think what is something that demonstrates value is I don't really think it's even a skill. I think it's really just more a mindset, and everyone can really have this mindset. It's not something you're born with. It's really something you can adapt. But it's again, it's the the ability to step outside of your comfort zone, and really kind of rethink how to operate. So what I mean by that is in healthcare, as a pharmacist working at a academic medical center, my day to day was really, really detailed, and it was very methodical. It was very thoughtful, right? Like I had to operate that way because it was medication safety, right? And medication use were really kind of hard things to kind of solve for, and you have to really be practical about these things. And so, in a sense, stepping into health tech, it's a little different because there are times when you may not have a process in place. There are times when you have to maybe take some guesses, right, and figure things out, iterate around the problem. And so, I got stuck. I mean, I will say, in the very beginning, I got stuck on how to do things because I had to kind of switch gears. And it was funny because there was a moment when I got on my very first call with, and this was a major health system at the time that we were, starting our engagement with, and my handoff was, we'll get on a call with them, and of course I have my team with me to kind of figure out how to start that implementation process. Actually, this is pre-implementation, so this is even before we implemented the solution. But I got on the Zoom call with a shirt and tie. Everyone was remote at the time, but here I was, kind of academic medical center pharmacist in his zone. I was like, yeah, let me just put on a shirt and tie. Really kind of formal kind of event. We're gonna really go through the agenda, all the things I used to do. And everyone else showed up with, like their polo shirt and like shorts and t-shirts, right? And I was just like, and then, I was just like, gosh, this is definitely like a new kind of territory. This is totally different. It was a little bit sort of embarrassing, but it was just kind of one of the things you learn. You learn from sort of like the silly moments, I suppose. So, so anyway, it was a bit of a shift. I think that's the biggest thing, is trying to really shift your gear quickly so you can kind of adapt to that sort of environment. I think that's the hardest piece. So it's not really a skill; it's more of just, I guess, a mindset. I don't know, but it was an important thing for me to learn, I suppose. So.
Yeah, I think that's important though. I think that mindset definitely is true. It's like your willingness to learn something new, deviate from perhaps old ways that you've developed, and really adapt quickly. I think that certainly is a very desirable skill set to learn.
Now,
okay.
I will say one thing around that real quick. the commonality with pharmacists doing what they do now and what they can do in health tech, there's a huge commonality with problem solving. So I know we brought up customer success as an example, but so for customer success, I may have and you may have like hundreds of customers that you have to interact with or work with, and each one, like each health system or each organization, it's very unique to their needs. So their outcomes may be completely different from another organization, but it's that capability or problem solving that really helps. So the soft skills, but also the problem solving skills, I think is something that pharmacists and healthcare professionals innately like have, because it's just something, it's very transferable, I guess.
Yeah, for sure. A nice way to add that little piece of nugget in too as well. Okay, so Beju, why don't we spend the last bit of the time here chatting about telemedicine, pharmacy technology, and your whole spiel. And to be completely transparent here, my knowledge is quite rudimentary in this area, so I'm all ears. And hopefully, there's a lot of audience members here that are also very interested in what you have to say. So why don't you tell us, pretend I'm someone that knows nothing about it. What do we need to know about telemedicine right now? What are the most important things? Whatever's on your mind.
Right. Yeah. I mean, I'll kind of start from the top. Basically, and maybe I won't get into telepharmacy specifically right now. Carrie, you kind of asked there, so maybe we can kind of speak about that, offline or afterwards. But just kind of give you more of a broader view, I think, is probably more important, because what is the state of telehealth? What is the state of telemedicine in the U.S. specifically? And so, as we know, like we've all kind of been through COVID, but prior to COVID, the rate of adoption of telehealth was it was fairly low. In fact, a few decades before that, the health systems, the big academic medical centers, were really the ones that started it all, right? They're radiology, telestroke programs. They were the sort of precursors, right, for all of this. But again, the rate of adoption is fairly low. So as we kind of turned the corner in 2019, the beginning of 2020, that's when that was really the catalyst, right, for adoption. It was unfortunate, but we had sort of the public health emergency, and so what occurred because of that, as a result of that, was a lot of the regulations we had in place sort of got waived, if you will. So it took away some of the barriers for providing actual telehealth. Enabled providers to conduct calls using different modalities, audio, video, different platforms, and then of course get reimbursed for all of these things while they were doing that. So again, it opened up a lot of barriers. One specific barrier I think was really important to know is for you pharmacists watching is for controlled substances. So in 2008, there was something called the Ryan-Haidt Act, and so the Ryan-Haidt Act, Ryan-Haidt was actually 18-year-old honor student, and he died because he was prescribed some narcotics inappropriately. It was actually a pill mill. So, it was like an internet pharmacy that he had got this from. And, the physician blanket signed his prescription, and he got, he had an unfortunate event. And so in 2008, there was this thing called the Ryan-Haidt Act that was enacted. And it was so that legislation would, it was an amendment to the Controlled Substance Act, but it was basically saying that every patient who gets a controlled substance must have one in-person visit before they are prescribed a controlled substance. So what that did was, it shut down all these pill mills, which is great. But the caveat is it made, it made it harder for actual legitimate providers who wanted to give controlled substances to their patients because of that, one-person visit, right? And so COVID kind of blew that apart a little bit, because there's an exception in the Ryan-Haidt Act that says if there's a public health emergency, which is what we were experiencing, right, COVID, then we can waive this in-person requirement. And so the side effect of that, it was great because it helped a lot of use cases. Opioid use disorder was a great kind of area. All this sort of waived in-person requirement. But what occurred also was a side effect of this was telemedicine startups actually ramped up here. So some of you may know Cerebral, some of these other companies that were really kind of churning out a lot of these stimulants, right? Or some of these like controlled substances and en masse. And so again, these federal policies are here to kind of protect the individual, but also protect the public. So I guess maybe kind of sum it up here and say we are now at the end of the PHE, so that those waivers were expected to be rolled back, but they haven't. So we've got a temporary 1 year grace period, 1 year grace period for these flexibilities, essentially. So we're still, it's a great kind of point in time because now there's discussion on from the lawmakers. Should we have more flexibility in place than we had prior to COVID? And so these are discussions happening, which is great because we're talking about access to care. We're talking about equity, right, of healthcare. We're talking about all these things. And essentially, I think pharmacists really need to be part of this discussion. In fact, there's a call, there's a discussion coming up very soon in DC where they're going to be talking about this thing called special registration. So I'm not going to get into it now, but like essentially it's a way for, and they're specifically said pharmacists in the sort of the announcement. So it's a way for pharmacists to sort of advocate for some of these legislations that we may not be using them now, but in the future, it's going to really help everyone who uses telehealth and telemedicine, without these like barriers that are from the regulatory standpoint. So overall, I think just to sum it up, where we started and where we are now are completely two different things. We're headed towards a really hopeful direction where we have maybe a little bit less or softening of legislation going on, less regulation perhaps, and hopefully that will enable all of us to help patient care overall and help all of these social sort of determinants of health as well as part of that. So yeah, really great sort of moment in time. There's a lot of action happening. And I think, if you're a pharmacist that doesn't do telehealth now, it's always good to kind of just be aware of these topics because who knows, in the future, it could affect our practice considerably, right? So
yeah. So it's super enlightening. I have a lot of thoughts on my mind and some follow-up questions as well. I think the first thing that comes to mind is how important public policy is, given something back in 2008, having that in-person visit as a requirement, but also having that caveat of a public health emergency, really demonstrating how important public policy is in terms of healthcare in general. And I say that because also when I was at the ONC, helping to inform regulation as well, one of the pieces that stuck out was, why can we not use biometrics, like on your phone, that everyone is almost like ubiquitous now? You can use biometrics to access your phone. Why can we not do that for multi-factor identification for controlled substance e-prescribing? And the reason why you couldn't is because of the Controlled Substance Act, and that did not allow it. But that's changed now. What I'm saying is, back to what you're describing, that was kind of a mind-blowing moment. So I'm very familiar with the regulation you talked about in 2008, but it underpins again why public policy is important, why pharmacists and other healthcare professionals should be aware of these pieces of regulations that's being kind of discussed, and how important it is to not only our roles but also patients. Now, a follow-up question to all this is, what are the most important things you think other pharmacists should be aware about in this space? Like, I know you already mentioned there's a discussion in DC, but are there any other salient, maybe one or two things that pharmacists should take away from what you know?
I mean, yeah, I mean, this is fun. So I guess we can go, I mean, we can go like into another hour of this, but like, I mean, I guess, really going back to the more of the clinical kind of side of things with pharmacy, in fact, the buzz right now on social media and all these news outlets is sort of these weight loss drugs, right? And so
Mm,
we're hearing like Ozempic, right?
yep.
Wegovy, all of these kind of these are all like what GLP-1 agonists and sort of
Yep.
really kind of paved way from like Biot. Biot, I think, was the first of that class that was introduced almost 20 years ago, 15 years ago, something like that. But I mean, all these are not new drugs, or in a sense, right? They're not new concepts, I guess, but they are being utilized quite a bit more. So in telehealth, certainly, we have companies, telemedicine startups that are actually prescribing these, at high volume right now. And there's a sort of like this need from patients that they and there's actually a survey done, this like by the Kaiser Foundation, and they found from that survey, 45% of patients would prefer to take a weight loss drug if they had that option. These are all
Mm,
overweight patients at certain BMI criteria. But and then so the other question was asked was, well, what if there's a high cost associated, which some of these drugs actually have a high cost, right?
mhm,
And then the sort of the response was much lower, like 17%. So it kind of dropped quite a bit. But kind of going back to this lawsuit that actually came about. There's a lawsuit for, I think, for Wegovy and Ozempic, both the manufacturers, and it claims, the person that's claiming it says that there was no explicit mention in their packaging for gastroparesis, so paralysis of the gut, right? And so she suffered these horrible consequences as a result of taking both of these agents.
mm,
And so, it kind of makes me think like, what are the safeguards in place for some of these agents? If you're using, these getting prescribed these agents through telehealth, prescriptions, essentially, who are they going to talk to about some of these side effects, downstream from the prescribing? And it ultimately comes down to like the pharmacy, right? Who really kind of safeguards these patients. Um, in this case, perhaps there's nothing to be done for some of these side effects, but certain patients, I think patients have a need to adjust their pharmacotherapy. They have a need to adjust their lifestyle modifications. Even maybe some things are missed and they don't know they have to have lifestyle medication, modifications adjusted. All of these conversations need to happen somewhere along the line, and usually it may be during the dispensing part, or maybe when they pick up their medication. So how do we, as pharmacists, how do we maintain that sort of safeguard, that guardrail, as we have more patients seeking these the care, virtually, or seeking it through telemedicine? I don't know. That's a
but
good
yeah,
question.
so Beju, this is super interesting. This is probably going to sound super ignorant on my part, but what is exactly the
Mm.
magnitude of the issue in terms of like, that's a scary thing with the lawsuit you just described. I think all of us can say
Yeah.
we want to prevent things like that. But at the same time, do you have a sense of how often that is happening? Is this, let's say, let's just pretend for a second to keep it simple. There's 100 patients that are newly prescribed to take these weight loss medications.
Mhm.
What percentage of them are actually falling through the cracks, not getting any counseling, not talking to any healthcare professionals? Like, what exactly do you have any sense on that piece?
Good question. Yeah, no, that is a really good question. Just from what I read, background reading I've read, the incidents are low for some of these. I mean, of course, these are drugs that have been on, like class of drugs that have been on the market for a while, right? So safety efficacy profile has sort of been established somewhat, but it's one of those things where, my question is, first of all, there's a lot of challenges with cost. So again, it sort of goes back to how do we how not only do we safeguard patients from some of these effects, but how do we triage and help navigate patients to the best course, first line therapy. So for weight loss management, there's three kind of buckets. It's really bariatric surgery is kind of one area, surgical intervention. And again, I'm talking about obese patients like BMI over 30 or 29.9, whatever, plus the comorbidities. But these are surgical interventions. Is the first bucket. The other would be sort of this pharmacotherapy, right? The medications, and then the third would probably be more of like lifestyle modification. So health in terms of diet and exercise. And so if they're not having these conversations with their provider, then perhaps they're having it with their pharmacist. And how how often are patients just taking these? So the concern here is, in the general sort of community, is, well, the sentiment is they're just going to get prescribed these drugs, stay on for a lifetime, and that's about it. This shows a significant drop in weight in many cases with some of these drugs. But should there be another component, diet and exercise, perhaps, right, as part of it? Or should there be sort of the first line therapy? Should that actually be a surgical procedure, right? There's some contention there versus medication therapy. So I think there's, again, it depends on the patient, but it's one of those things where is the patient getting the right information so they can actually make that informed decision, and where are they getting it? If they're not getting it upstream from the provider, then they certainly should be getting it from someone in the healthcare system, perhaps pharmacists, right?
Sure.
So,
and I think this is coming very much from like a public health side of me. And one of the first classes we learned in public health is how do we solve public health problems? As you described this, to me, the first thing that came to mind was, this sounds like a public health problem, and of course, back in the day, it was like more than 66% of Americans are classified as obese. We have an obesity problem here, right? So that's one. And if that's the case, if that's the case, there's probably a lot of individuals who are interested in weight loss medications. And to be honest, I would think anecdotally that most people would rather take a pill than exercise, 150 minutes a week. It just seems like something that most people would want to do. Like, why would I spend 150 minutes suffering when I can just take a pill? So I would think that weight loss medications is ideal. Now, with that said, in public health, the second thing we talk about after defining the problem, if it is a problem, what is the magnitude? I think I still have a hard time understanding what exactly is the magnitude. If it's like 1 out of 100 patients that are falling through the cracks, perhaps the problem is not as large as 99 out of 100. But just the statistics I just talked about, a lot of obese patients in America, a lot of patients that probably want a pill. I imagine the magnitude of the problem is probably large, but it would be nice to know more about, describing what is the magnitude, what are the outcomes, and all that kind of stuff.
I agree. I 100% agree. And I think the other, and just to talk in regards to what Carrie just mentioned, who is paying for the pills. So there's other issues about, right? There's sort of the cost, right? We talk about coverage. So right now, the other controversy is a lot of employer-based programs. They're either not covering or dropping coverage in many cases. So these are like thousands of dollars per week, kind of very costly out-of-pocket drugs. And also in tandem to that, Medicare Part D does not cover these at all. And that kind of goes back to our earlier kind of conversation thread about public policy, because Medicare Part D in the past was created so it would exclude these weight loss drugs intentionally because the perception at the time, was basically, these are all kind of cosmetic needs. Now we know these are like, this is a disease state that we have to treat. It's actually not a cosmetic issue, it's a disease. And so now the conversation is changing. But the problem, the challenge is, how does Congress essentially, how do they um, get the data they need, the information they need to add this, get this added to any sort of amendment to that reimbursement? Because honestly, this will probably blow up the budget, right? It's gonna be these expensive things. But the conversation that's not happening is they're just talking about weight as a disease state. They're not talking about hypertension, diabetes, all of these other issues that are part of that problem. And a lot of these patients are already have these comorbid states. These drugs work really well and on some of these states as well. So there's no discussion around that as part of that reimbursement or cost equation. So there's a lot of going back to that sort of earlier thread of we need to look at public policy to sort of figure out how to solve for some of this. I think that's a really important conversation that's happening today. So thanks, Carrie, for that question.
Yeah, a quick pitch on public health as well. So what we learn as public health professionals is, one, identifying these problems, right? Two, quantifying the problems. And if there's no data that quantifies the problem, then you don't know how large the problem is. You have to go out and collect the data. So then the next question for me becomes, are we collecting information about this? And if not, should we be collecting information about this? And because all of this data goes at the very, very, very last stage, is we draft public policy based on all this. This is the whole public health cycle. We collect the data, see what's going on, what is the best interventions, and then we draft the best regulations to encourage that kind of behavior. So if we don't have payer support, we need to get the data if it doesn't exist, and we need to make the case to draft good public policy to encourage healthy Americans. With that said, it seems like there's a lot of comments, Beju, that you can probably address here with the, let me see here.
Yeah, Tony asks, how do we prove that pharmacist involvement in the development of telemedicine is essential? I think I got that right. Sorry, got cut off a little bit. So how do you, so Tony, maybe you could ask that another way, but I what I'm kind of inferring is like, where's the value? How do we demonstrate value? So where we can like demonstrate outcomes, essentially is I think what we're getting at. And I think proving it is great. I think we should be doing pilots. We should be running studies, right? Like, I mean, there's quite a few out there, not in telemedicine specifically, but just in healthcare in general. Like, we're making interventions that have a positive outcome for certain patient populations. So I think this is a great, like, I just had a student from MUSC, just, in my city, reach out a few months ago, and she's starting a smoking cessation clinic at the free medical clinic. And so she's a P3, P4, I believe now, but P3 is when I talked to her. And, she reached out and said, hey, I feel like we could use a telemedicine solution, a virtual care component of our clinic, so that we can kind of still have patient visits and, not have people drop off the schedule or whatever. And so I thought it was great. I thought she reached out. So first of all, I was super impressed, right? Because that's sort of like a really kind of a leadership trait. I feel like it's really important. But she also is taking action and trying to figure out how to solve for it in a local kind of community setting. And so, we set her up with the program. And, one thing that I encourage her, I think would be great to see is like, is actually kind of creating a small study out of this, right? And looking at the evidence behind it. So I think the proof is in the pudding. So if you can kind of figure out how to kind of create a workflow that integrates a hybrid component like she's done, I think that's a great thing. The second component here, the conversation talking point I would suggest is, sure, you proved it, maybe you've measured it and proved the value. It's our obligation. Again, another leadership trait is like, to kind of share this with others. So like often lawmakers, I've spoken to my local kind of legislator here, and one thing that surprises them is like pharmacists talking to them, first of all. So that's really great, right? And it's like, it's just eye-opening to see, like, they just love it, because they probably haven't had a pharmacist talk to them, or they already know the value of pharmacists. But the other thing to talk about these studies, talk about the value that these are doing, and then maybe kind of stay up to date with the policies that are occurring, and voice your concerns. I mean, really, that's what it's about. Frankly, I haven't done that in the last 10 years as much as I would like to, but I'm really kind of getting sparked up about this because I'm seeing sort of how our voices translate to actual change. And going back to sort of this public health emergency ending conversation that we just had. So the DEA and some of the federal agencies put out a notice prior to the temporary flexibilities coming in place. They put out a notice saying, essentially, we've got 30-day window where you can share your comments, public commentary, into these proposed plans that we have. They received just over 30,000 comments within that 30-day window from everyone. It could be pharmacists, could be like just general public, physicians, nurses, whoever. And what that did, like that large kind of set of comments actually allowed us to have another conversation on like, okay, well, we can't revert back. We have to do something else. We have to expand access. And so now these conversations are happening with legislative decision makers. So it's kind of one of the things where I think, again, we really need to kind of look at how to measure value, create value, and then advocate for that value, I suppose. Does that make sense, Brian? Is that sort of, I don't know, Tony, does that answer the question a little bit?
Yeah, and just to comment too is I love how this turned into a very much public policy perspective, and I absolutely love that.
Yeah.
And I'll give a different perspective from the other side. So a lot of the MPH program I took was 80 credits. 40 credits must be in general public health. The other 40 credits you can take in electives. I spent 20 of those elective credits in public policy. And they taught us about what you just described in terms of public comments and things like that. But during that last year in my program, I also was officially a federal employee at the Office of the National Coordinator for Technology, ONC. And being on the other side, at the time when I was there, it was the 21st Century Cures Act that was on a proposed rule. And they had the exact same thing. The official term is called Notice of Proposed Rulemaking, or NPRM. It's an opportunity for the public to make public comments on a rule that will eventually become law. So that's an opportunity for the public to voice their opinions. What's interesting is prior to joining the ONC, I was like, do these people actually listen? Do they really care? Well, I can tell you, being on the other side, after those comments were submitted, I spent the bulk of my internship reading every single thousands of comments and summarizing it and making a lot of recommendations and having discussions with our other agencies, other stakeholders, in coming up with that finalized rule. By law, every single one of those public comments are read. So I love that you said that, Beju. We should be involved in these processes. That's how we get our opinions and our education and knowledge out and influence regulations, because every comment, no matter who you are, and there are many individuals, not organizations, individuals that submitted comments on what we should do to be better. And it's read, it's acted upon, and I absolutely love it. I think this was like a very fun live stream for me because you brought up a lot of good points that it would be great to see more of us as pharmacy embed our opinions.
And I will say, also like Carrie also just mentioned, especially students as well. Like really, I feel like students are really kind of energized, getting out, in the profession. And I think this is probably what I used to do as a student, more so, and I sort of lost touch with it. So I'm kind of like glad we had this conversation because it kind of, and knowing that on the federal side, these agencies are really kind of looking at a lot of your perspectives. I think that's really, it just kind of lights a fire in sort of that respect. So this has been a great conversation, Brian. Thank you for having it.
Yeah, and we're actually over time too, and it was fun, very enlightening. Thanks for sharing your telemedicine knowledge and advocating for this, Beju. Hopefully, we can chat again in the future as some of these developments come about, and maybe you can share as those things develop. But
absolutely, yeah. No, thanks for having me, and also just thanks for everyone joining in and asking really thoughtful questions as well.
Yeah, shout out to our audience members for tuning in and staying with us for the entire hour. Again, spending your Saturday with us. And I guess that's it. That maybe we can wrap this up here. Thanks again, Beju. And I'm sure we're going to have you on again in the short term. Cool.
Sounds great.
All right, guys.